Good evening, Dr. Harshawardhan Hegde,
Good evening.
and thanks for doing 5 questions with Medsolin. Sir, in your 25 years of experience in orthospine surgery, what was the most complicated case you have come across?
The most complicated case that I can think of the top of my head was one that challenged me a hell of a lot. And this young girl came from Russia. She had been actually seen in Russia and Israel, and then she was told that there was no surgery possible. This was a rare case of a double curve in the thoracic and lumbar spine with a further twist in the cervical spine. She had no neurology, but her deformity was severe. And, sorry, deformity was severe. So we had to stage this correction. So initially we did a thoracic and lumbar correction, and then we did a cervical, and then as a second stage we joined the cervical with the thoracic and lumbar correction, so we could achieve a near straight. It's good to know that this young girl is now more than a year and a half of surgery, and she's doing rather well. She was swimming and attending to her classes and doing good. But it was a challenging case because it had various neurological elements and also a very deformed spine.
Well, to add on to the question, sir, then how long was the surgery, the duration of surgery?
Well, the first surgery took us about 6 hours, and the second one took us about 8 hours.
Wow.
Totally, we worked on her for about 14-15 hours.
Wow. Next question is, sir, what are the top risk factors that the patient is made aware of before going into surgery?
Well, the top risk factors in all orthopedic surgeries where implants are used, the topmost I think would be infection. So this is something that we tell the patient, though we cover the patient with antibiotics and take all precautions into operation theatre, there is still a less than a 0.5% chance of getting infection, which can be catastrophic for the patient. Apart from that, there is deep vein thrombosis that can occur, and occasionally these thrombi can get loose from the legs and go into the lung and cause pulmonary embolism. Other problems are minor in terms of this, but these are the two main complications that I usually tell my patients to.
Thank you, sir. The next question, what kind of post-surgery support do we offer to patients?
The post-surgical support in all orthopedic cases is what we look at very seriously is rehabilitation. Now, before that, during the early phase, we keep a patient in the ICU, in intensive care unit, simply because there are first few hours, about 24 hours, when complications can occur. If we are over that, then we start exercises in most patients in 6 hours and get them moving in the bed, and in due course get them out of the bed and start walking around. And this isn't true for all spinal surgeries and almost all joint replacement surgeries and trauma surgeries. So we are looking at rehabilitation as being the main focus. And if the participation of the patient in recovery is not as much as the role played by the doctor, then of course sometimes the results get compromised.
Fine, sir. Question number 4 is, how are the healthcare technology and treatments in India are rated across the world?
Well, the healthcare technologies, India follows the international standards very closely. For example, the hospitals, the operation theatres are of very good quality now. And our infection rates, our complication rates are comparable with the best in the world. The other, in terms of newer technologies, for example, navigation, which has now become the hallmark of all surgeries, whether it's joint replacement or whether it is spinal surgeries. We have started using the latest navigational techniques both in the spine and in case of joint replacement. So I think we are, if not along with the West, we are very close to advanced centers in the world, whether they are in US, Europe, or Japan, or Australia.
Fine, sir. Final question is, looking at your experience of 25 years, sir, can you sum up with the number that how many successful surgeries you must have performed till date in the field of ortho spine surgery, sir?
Very, very difficult question to answer because I have done a lot of surgeries. I've worked in hospitals where, government hospitals in India, very, very busy, and I was a professor in a medical college for about 10 years, which is a huge number of surgeries. And along with it, I used to do private practice. Now I'm essentially into corporate healthcare where the numbers are not so much, but it would be on an average that I operate around 50 cases a month personally, maybe 50 to 60, and with my team around 200, 250 cases, which would be part of our, thousands of cases. It would be difficult to put a number, but yes, I've done a lot of surgery.
Well, then just to add, because you have mentioned about corporate hospitals, and you just said it because you have worked it, you are so vast experience. What are your views on medical value added treatment in India, oblique medical tourism, sir?
Well, I think India is one of the best destinations for medical tourism. There are a couple of things why. Standards of healthcare are, like I said earlier, almost comparable to the West. Number two, the cost is a fraction. Compared to US and Europe for international, what I mean is private patients, the cost would be about 1/8 of what they're paying. Even compared to places like Thailand and Singapore, which are also tourist destinations nowadays for healthcare, we are much cheaper in India, and the standard of care is almost the same. So I think it's a very tempting offer. Most of the surgeons are very well trained in India. They've had, if not a couple of years, at least, like in my case, I've been abroad for about 8 years, which has exposed me to a variety of surgeons, a variety of centers, a variety of philosophies. So then over a period of time, you develop a way of working, and this helps you to take it forward. I would think that India is a great destination for healthcare.
Thank you so much, sir. It's a real pleasure to have you today. A good day.
Thank you very much.